Ladies and gentlemen, thank you. Welcome back for our second hearing for today. It's the one before the last hearing. We plan to have 3 inputs in this hearing. It's about access to health. Unfortunately, one input will be canceled because the participant, unfortunately, is very sick and she will try to contribute tomorrow. Now, our first input would be about violation of migrants and refugees' right to health during the COVID-19 pandemic. This will be done by Francis Weber, Institution of Race Relations from the UK. All these following hearings will be through the video conference, and I also would like to say thank you for the online participants for being with us. We have around 50 participants during the first hearing, and thank you for staying for this late time. Now I will leave the floor for Francis. Thank you.
Thank you very much. Okay, can you hear me? Okay, good. So first I want to just congratulate the organizers for putting this tribunal together. It's fantastic. At any time, having been part of the London steering group for the London Tribunal in 2018, I have some awareness of the obstacles and the work that is involved in organizing a tribunal, but you have had to overcome unprecedented technical obstacles as well. So congratulations and many thanks also for holding the hearing in English. So I represent the Institute of Race Relations and the PPT London Steering Group. Our focus is on the pandemic and how that has illuminated and aggravated the devastating impact on migrants and refugees of the British government's hostile environment immigration policies. So tomorrow, my colleague on the PPT steering group, Angie Garcia from Walling Walling, is going to talk about the impact of the pandemic and the hostile environment on a particularly vulnerable migrant group, domestic workers. So I'm going to speak to the written submission, which is here. Can you see that? Have you got that? Okay, it's about survival now. And it's based on evidence and reports sent in to us from groups who participated in the London hearing and on material published by the Institute on its news service. The whole written submission is available on the website of the PPT London Steering Group, which is called migranttribunal.org, Migrant Tribunal, all one word. Okay, so everybody agrees that the pandemic is having a disproportionate and devastating impact on Black and minority ethnic communities in the UK and on poor and deprived communities. So both of those groups contain a lot of refugees and migrants. The government knows this. It commissioned a report from Public Health England that bore it out. There's been loads of published studies. They all say the same thing. But the government has done nothing to address this devastating impact. And it has blamed comorbidities. It has blamed all sorts of different health conditions. It has blamed even people's jobs, overcrowded households, and deprivation, as if those things were lifestyle choices rather than conditions forced on people by institutions. So our submission looks at the violations of migrants' rights to health under two general heads. First of all, creating the conditions for ill health, and secondly, denial or obstruction of access to healthcare. So the first thing, creating the conditions for ill health, we say that the government has done this by housing asylum seekers in mass accommodation where they cannot follow the guidance to self-isolate or wash their hands. It has refused to lift immigration policies and conditions which endanger migrants' health. So mass accommodation, first of all. Early on in the pandemic, we saw that while the government tried belatedly to suppress the virus in the population at large, it seemed to be applying a different strategy to asylum seekers, immigration detainees, and prisoners. The strategy seemed to be containment without regard to their health needs in order to protect not them, but the British public from them. Like a milder version of the camps in Greece and of the militarized quarantine in the Czech Republic, which locked down whole Roma settlements. The government has refused to empty detention centres, even though detention is supposed to be for the purpose only of removal, and even when people could not be removed from the country, it refused to empty detention centres and even challenged judges who were ordering the release of detainees, which meant that actually detention centres did lose about 3/4 of their population, but that wasn't the Home Office, that was the judges. The Home Office has intensified the concentration of asylum seekers in mass accommodation where distancing is impossible, sanitation and hygiene facilities poor or non-existent. Hostel accommodation for asylum seekers is privatized and often filthy, squalid, dangerous, and infested with rats and insects. One notorious hostel in Yorkshire contained over 260 people in one building, sharing canteen facilities, sometimes sharing bathrooms and bedrooms. So it's not surprising that there were COVID outbreaks in asylum accommodation. At the height of the first wave, over 300 asylum seekers were moved out of self-contained flats in Glasgow into hotels. Their meagre weekly allowance of £39, roughly €40, was taken from them. 2 weeks later, a Syrian refugee committed suicide. And a month after that, a Sudanese man broke down under the strain and stabbed 6 people and was shot dead by police. And it seems to be recognized generally that these mental health crises were brought about by concentrating these asylum seekers, moving them from their self-contained accommodation into crowded, insanitary, dirty hotel accommodation. And now asylum seekers are being crowded into old military barracks surrounded by high fences and barbed wire in Kent and in Wales. An official inspection report which came out today describes reception facilities for the people crossing the channel in small boats. So a reception area in Dover resembled a building site. Detainees were arriving wet and cold, but often had to spend hours in the open air or in cramped containers. Basic supplies, including dry clothing, ran out during the inspection. Some detainees were placed in escort vehicles in wet clothes. Some detainees were held for more than 2 days in rooms with no sleeping facilities, no showers, and no access to open air. The Kent unit was crowded and poorly ventilated. Social distancing was not possible, and there were no hand washing facilities or even sanitizer in the women's toilets. This was an inspection carried out in September, 6 months into the pandemic. So these are the conditions that asylum seekers face in the UK. Conditions which are almost guaranteed to cause ill health and to expose people to the pandemic. In relation to other migrants, so the government has refused to lift a number of conditions which make life impossible for many migrants in the UK. There is a condition that most migrants are, their residence permits say no recourse to public funds. So that means no welfare benefits. And obviously, if people have lost their jobs as a result of the pandemic, they can't, if they're no recourse to public funds, they can't get benefits. They're not entitled to the government subsidies or support that are being offered to people. An estimated 1.4 million people are barred under this condition from access to welfare benefits. So if those migrants do have jobs, they can't afford to stop the work if they fall ill, because there will be no welfare benefits for them. And that again is likely to expose people to the virus. And there are many people. There was a man called Elvis who was a cleaner for in the Ministry of Justice, although he was working outsourced, and he died of COVID because he simply could not afford to stop work. He was one of many. A study by the Migrants' Rights Network and others found that people with this condition, no recourse to public funds, are more likely to become seriously ill or to die if they contract COVID. But despite this, they can't access the help they need. So the government was asked but refused to regularize undocumented migrants, so as to allow them to work or claim benefits. It's refused to suspend hostile environment policies, which criminalize unauthorized work, prevent access to rented homes and to healthcare. These policies were designed to encourage people to leave the country by making life impossible for them. But even when it was actually impossible to leave the country because the borders were closed, the government refused to waive or suspend these policies. So within the NHS too, institutional racism has endangered the health of migrant workers as well as that of patients. A new report from the NHS Confederation Black Leadership Network, which has only just come out, and so it's not in our written submission. It's called COVID-19 and the Disproportionate Effect on BME Communities, Perspectives from the Front Line. It's based on a survey of Black and minority ethnic NHS staff, and it highlights the institutional racism within the NHS towards BME and migrant health workers. 70% of frontline NHS health workers who had died of COVID-19 by mid-April were Black or minority ethnic. And the Filipino Nurses Association said that more Filipino nurses and care staff had died in the UK than in the Philippines. Filipinos accounted for a quarter of all deaths in the NHS workforce and nearly 1/3 of deaths among nurses. The NHS Confederation report went some way to explaining this by describing how BME and migrant staff have been pushed, bullied, pressured, and intimidated into frontline roles, often in the early days without any personal protective equipment. So that's the section about creating the risks. Then I just want very quickly to move on to the second issue, which is denial or obstruction of access to healthcare. The main obstacles to healthcare for migrants are NHS charges and the fear of debt, and for undocumented or precarious migrants, data sharing and fear of detection and deportation, and also language and digital lack of digital access. So charges, regular migrants, workers must pay a health surcharge, currently about €690 a year when they get or renew a residence permit. They must pay the whole amount for the duration of the visa, which is generally 2.5 years. So a family with 2 adults and 2 children must find nearly €7,000 for the health surcharge in front of the visa fees. So they must find a total of about €10,000 altogether. Undocumented migrants and refused asylum seekers needing non-emergency hospital treatment must pay 150% of the cost of treatment in advance. This applies to serious and life-threatening conditions, including cancer. Pregnant women and newborn infants are not exempt. Although refugees, asylum seekers, and people with infectious diseases, including coronavirus, are exempt from charging, they are often wrongly charged because the exemptions are not widely publicized, and also because the charging regime has completely changed the relationship between medical staff and patients. It has destroyed or damaged the mutual trust that was there. So the main effect of the charges has been to make undocumented or low-paid migrants unwilling to seek hospital treatment. Then in 2018, it was discovered that the NHS was sharing confidential patient data with the Home Office for immigration enforcement. The government has since claimed that this has been suspended. but the fear that seeking treatment. Yeah, I'll just finish, but maybe 1 minute. The fear that seeking treatment could lead to detention and deportation acts as a powerful deterrent. Language problems, much public health information is not translated. Ring the NHS helpline, and it's very difficult if you're trying to say, I don't understand English. And additionally, online services, including medical consultations, are not available to poor migrants when community centres and libraries providing free online access are closed. People simply don't have and can't afford the digital access. Okay, so migrant communities are battling this, battling racism, battling the virus, trying to keep traditions of solidarity and mutual support alive, and trying to publicize the situation and make demands for all their communities to enjoy basic rights to health. And the PPT London Steering Group has called for a rights-based approach to immigration policy in its manifesto for migrant and refugee rights. Thank you.
Thank you to Frances. Now the second contribution will come from our co-convener, Transnational American Platform Europe and Migrant and Self-Organizations, and they will report on migrant and refugee health, violations of the right to health and the access to healthcare for undocumented migrant and refugee people in the Netherlands.
Hi, good evening. I'm Yasmin Soraya from the Netherlands. First of all, I would like to thank my colleague Petra Snelder from TMP to give opportunity for me to speak in this very important session. And thank you all for the opportunity so I can deliver all the problems what I experience in my works. First of all, I would like to introduce myself. I work I've been working with Indonesian undocumented migrants for more than 10 years in the Netherlands. Our members are not only from the specific city, but they are mostly spread out in all cities in the Netherlands, like in Amsterdam, The Hague, and Rotterdam. And for the last 2 years, I'm also working for The Hague World Highs. That's an organization in The Hague, which we give assistances and we give advice for the undocumented migrants. Not only specific for Indonesian migrants, but also from various migrants, all migrants from the various countries in the world. In my experience assisting the migrants in The Hague, in this opportunity, I would like to deliver the problems about what I see and what the migrants experience on the field. And my colleague Petra Snelder will explain about the regulations regarding of the accessing healthcare in the Netherlands. The migrants, when they are sick and they need to go to the doctor, in the Netherlands, they have regulation that they can go to the general practitioners, but not all general practitioners know that they can help people even though without document. Some of our migrants, they are asked to be paid or even to give the information about their residence permit, and it's very difficult for them. And there are some of them are afraid to even to go to the doctor. And also in the hospital, um, usually the administration make it more difficult because they ask for the insurance and also for the money to access the healthcare in the hospital. Um, we as organization in The Hague, we try to give awareness to the doctor, general practitioners, and also to the hospital that all migrants, regardless their residence permit, they can access the healthcare. And until now, even though it's difficult, but we can, our migrants, they can access the healthcare. And however, some of them, they still get the bill that they should pay, and it's very expensive, and they cannot pay the bill. And in the Netherlands, there is a institution that can help to pay the bill for the people without insurance. And Petra will explain about it. And to access the medicine, there is a rule that the people without document or without insurance, they can get the medicines, but they have to pay at least €5. Even maybe we think €5 is nothing, but for the undocumented people who cannot work, they have no rights to work, and they have no regular income. €5 is a big thing. And in The Hague, thanks to the diocony, diocony helped the people to pay €5 so people can get the medicine without paying. It happens, the problem to access the medical treatment, it's not only for the people who have physical problem, but also psychic problem. We have, I have seen a lot of migrants that have psychic problem, and it's difficult for them because they don't even have place also to go. I mean, for the people who are sick, if they have family or people they know, they can be helped. But for the migrants who have no one, it's difficult for them to get the treatment and also place to stay. They cannot access the shelter because we call it the government, the local government will decide who will get the shelter or not, and there is no basic how do you say, information how sick is the person that can get the shelter. So a lot of people sleeping on the street because of that. And my last information maybe in regards of the COVID, a lot of people now when they have symptoms of COVID, they want to do the test, and it's a little bit difficult to access the free test that government provide, because they ask for the SOFI number, and a lot of undocumented people, they don't have SOFI number. But with our assistant, we can explain that all people, even though they don't have SOFI number, they can do the corona test. Less things about the healthcare for your teeth and for your mouth cleaning. How do you say, the treatment of the teeth? There is no, at this moment, insurance at all for the undocumented people. They need to pay themselves. And luckily, in The Hague, we set up on friendly networks, that is networks of dentists, and they can go to the dentist, and the social funds in The Hague, they can help for the payment of the cost of the dentist. So that's all the problem that we experience on the field, and I will give the floor to my colleague Petra Snelder to explain in more detail about the regulations in Netherlands. Thank you very much for the opportunity.
Yes. Hello. My name is hello everyone. My name is Petra Snelders. I'm from the Transnational Migrant Platform Europe, and I also represent the Respect Network Europe. It's a network of migrant domestic workers organizations. And thank you very much to give me the opportunity to give you a short overview of the rights to health of migrants and refugees in the Netherlands, or better said, the violations of those rights. We have submitted a report for this PPT that you can find on the website. In the report, the experience are brought together of more than 50 migrant and refugee organizations and support organizations, key staff members and health organizations who are working with migrant and refugees communities, and information from very different reports. In general, the right to health and healthcare for migrants and refugees in the Netherlands is disproportionately negatively affected by factors such as precarious socio-economic position, the quality of houses, and unhealthy or dangerous labor conditions without proper protection even in this time of COVID, and if forced to work closely alongside with others. In our submission, however, we focus especially on the situation of undocumented migrants and out-of-procedure refugees. In principle and on papers, undocumented migrants and refugees have some rights to healthcare in the Netherlands. We also already heard it from Yasmin, that are, however, many obstacles to achieve these rights. The root of this problem is the legal framework, the so-called Linkage Act. And in this act prohibits people without immigration status access to all social services. And access to healthcare is only possible when it is medically necessary care. And meant with that is that it is care that is covered in the Dutch basic health insurance, and so dedicated also by the doctors. But as it already implies in the name, it is very basic. For instance, dental care for adults, it's not part of it. Physiotherapy is not part of it. Contraception is not part of it. It's all not covered. Most Dutch citizens therefore find it necessary to take out an additional health insurance, and something that is impossible to do when you are undocumented due to that Linkage Act. Health practitioners can reimburse costs of basic medical care of undocumented. However, this is a bureaucratic and a complicated procedure. Not all health practitioners are familiar with this procedure, and the procedure itself can take up to more than 1.5 years before reimbursement will happen. In our experience, this is regularly a reason why some health services is denied to undocumented, although the right is there. Furthermore, health practitioners are obliged first to ask the undocumented patient if she or he are able to pay for the bill. We also heard that from Yasmin before. This creates a lot of pressure and a feeling of humiliation, causing that somebody rather will avoid necessary health care than to endure this kind of procedure. Also, out of fear of being reported to the authorities, undocumented migrants will be hesitant, even in emergencies, to reach out for the necessary health care. Since the general practitioner, the family doctor, is the front door to other healthcare services in the Netherlands, except the hospitals, registering to a GP practice is essential. However, GPs are often reluctant to have undocumented or too many undocumented migrants as a patient because the bureaucratic system that takes a lot of time and delay in reimbursement of costs, or because the extra work burden for GPs, since many undocumented migrants have, due to their unsafe and unsecure circumstances, often complicated health issues, as well physically as psychological, or because of the false notion that undocumented migrants has no right to healthcare. And this notion has often undocumented themselves too, thinking that they don't have the right to healthcare at all. Being locked outside the official and state system of healthcare, undocumented migrants can only rely on two main sources of support: their own self-organizations or from solidarity and human rights organizations. The result is that undocumented are too much dependent for their access to healthcare of social networks and support community organizations that can provide that knowledge on their rights and or act as intermediaries. So although on paper there is limited access to healthcare for undocumented, the reality is much more reluctant. And this is also true for the growing older generation among the undocumented, often living and working already for decades in the Netherlands. They often have additional health needs related to their age and to the nature of the work they have undertaken all those years. It is also true for the children and youth and the impact on the psychological and mental health of being undocumented, although some of them are living in the Netherlands since a young age or even born there. Psychological and mental health care is hardly accessible for undocumented migrants, while being undocumented, on the other hand, has a huge negative impact on the psychological and mental health. It leads to constant anxiety, tension, and fear of being discovered, being reported, being deported, and the loss of livelihood, which is the mainstay support for their children and families in the Netherlands and in their home countries. The problems in accessing the care, but also the complicated Dutch mental health care system itself, cause increased traumas and deterioration of symptoms. Undocumented migrant women experiences the impact of the lack of access to healthcare again also in other ways. Many of them started to be documented but lost their visa for various reasons. They are now often working as domestic workers in private households, in hotels, catering, and industries, not always, but regularly in unsafe and even exploitative labor conditions. For those in a violent relationship, they have on paper the right to an immigration status on humanitarian grounds if they can prove the violence. However, the last decade, the burden of proof has been increasingly difficult. They need as well declaration of the violence from the police or the prosecutor, as well from the shelter or support services. While it is very difficult when you are undocumented to find shelter or that support service. Data shows that more than 80% of the women who has to deal with domestic violence with an dependent resident permit are granted continued residence based on domestic violence. For undocumented women, it is even only 25%. And those are data of women who did apply. Many of the abused women will not come forward for fear of deportation and try to find other ways to survive. Women living in asylum seeker centers are often inadequately protected by the Center from Gender-Based Violence. Those who are the victim of violence are excluded from regular and specialized shelters and support services. They have only access to the most basic non-specialized shelters and support services for asylum seekers. And the same is also the case for those LGBTIs who are experience violence within the centers. Migration is not a crime. Nevertheless, the detention of undocumented migrants has become commonplace in the Netherlands, as it is in other EU countries. Immigration detention has a profound impact on the physical and mental health of the detained and on their relatives and the friends outside, as many reports shows. In the case of children in detention, in principle that's not allowed in the Netherlands. For the purpose of deportation, children and their family are detained in so-called closed family facilities. Families have their own living units where they can cook for themselves and there are some activities for the children. However, there is a closed fence around that facility. The families are often moved to other facilities. There is no privacy and there is hardly any care to deal with the traumatic experiences of the children. Deportation occurs early in the morning, what is particularly for the children extremely stressful and traumatic. They are lying awake in anticipation on a knock on the door. Will this be the day that they will be deported? And every day they are missing friends that were deported that morning. I like to finish with a few of our recommendations. In our submission, we are mentioning more. First and foremost, uphold the human right to health and healthcare for everybody based on the principle of non-discrimination in all areas of prevention, protection and treatment, as well physical and psychological, and with disregard of immigration status or ethnic origins. Ensure that those rights are not only on paper, but are implemented in reality. Implement regularization of undocumented migrants and refugees. The lack of immigration status is in itself a key factor of risks to health and well-being, leading to serious and sustained violation of the right to health, physical and psychological. And stop the criminalization of refugee communities, stop the detention of migrants and refugees, and break with the policies of seeing migrants and refugee peoples as Europe's problem, but place a human rights-based approach at the center of policy frameworks and end the policy of double standards, systematic violation in the access to the human right to health and all other human rights. Thank you very much.
Thank you very much, Francis. Thank you very much, Thuraya, and thank you very much, Petra. They highlighted points from the UK to the Netherlands of the difficulties facing refugees and undocumented migrants accessing health care, especially during the corona. From these points, they share the cost, the regulations, administration, and fear of the deportation, as well as when they are forced to be deported, as Francis explained, why the borders are closed. Now, with these points, we would like to ask the jurors if they have any questions.
Thank you for your interesting inputs. I have a question on the situation of undocumented migrants in the Netherlands. So as far as I understood, there's a very limited healthcare available for undocumented migrants that is covered by the state. And you said that migrants may visit the doctor, but my question is, can they also be transferred to a specialized doctor, or does this healthcare only cover like an examination by a general practitioner? And my second question is, we heard earlier in Germany the problem is that data, well, as soon as the welfare office comes into play and covers the costs of healthcare of undocumented migrants in Germany, their data is transferred to the immigration authorities. And you also mentioned that in the Netherlands, migrants fear being discovered if they seek healthcare. So could you maybe elaborate on whether they are in risk of their data being transmitted to the authorities? And the same question on healthcare for undocumented migrants in UK. Did I understand correctly that basically in UK, healthcare is limited to absolute emergencies, or can undocumented migrants be treated for acute illnesses that are not an emergency in UK under NHS without having to fear that they are discovered and deported.
Can we check if we have anyone to answer these questions from our speakers? Maybe Thuraya or Petra from the Netherlands to ask the question regarding the Netherlands and Francis?
Shall I start?
Yeah, go ahead.
The question was about access to specialized services. As I said, the only access is the access to if the medical necessary care. So even with, for example, psychological help or going to shelters, there must be a reference by somebody who mentioned that it will be a medical necessary care. Of course, there is a possibility if you are paying it for yourself, and that means a lot of money. For example, some surgeries in hospitals that are not covered by the medical necessary care insurance. And so that will not be reimbursed also by the state. Of course, it is possible to try to have to find a hospital that gives you your that surgery, but you have to pay for it. And some hospitals will do it. Some hospitals will not. There are some hospitals that is known that they are on the list of hospitals that also give healthcare to undocumented. Regarding the data and the reporting, it is especially that people are really very afraid of being reported to the authorities. It is mostly not done. It's not supposed to be because the health there is an how do you call it in English? Normally, it is a client or a patient confidentiality together with the health practitioner that there will not be a reporting to the authorities, but of course you never know for sure, and that makes it really very difficult. It is all really dependent from the person that will help you.
Okay, thank you. She's still muted. Do you have something to add? Sorry, you were muted. Okay, maybe Francis? Okay. And from the Netherlands, I cannot see the screen clearly. Do we have? Okay, Francis.
Yeah.
Thank you. Go ahead.
Yeah. So the question was about undocumented migrants' access to non-emergency healthcare. So in the UK, access to GPs, to general practitioners, remains free, although many GP surgeries don't seem to understand this, and so many undocumented migrants have difficulties registering, but Doctors of the World is one of the groups that has been working to try to get registration campaigns. But in relation to hospital treatment, the only hospital treatment that is free is emergency hospital treatment. So once the immediate emergency is over and you've had the operation, say, to remove a tumor, then all the rest of the treatment is paid for, must be paid for. And it was, I think it was in 2017 that the government made it stipulated that the payments must be made in advance, that so that any patient who doesn't have the correct documents, so first of all, that means that obviously everybody has to be checked. Then patients without the correct documents must be charged in advance at 150% of the actual cost of the treatment. So that applies to cancer treatment. One of the Windrush generation people who was in fact legally in the UK, but was deemed to be illegally in the UK, he was given a bill for £64,000, which is over 70,000 euro, to have cancer treatment, and he could not have that cancer treatment until he had paid that money. Does that answer the question?
Thank you very much. Is there any other questions from the jurors?
I have a question.
Okay.
May I?
Yes,
Okay.
please go ahead.
Okay, thank you. Thank you very much. This is a question to all of the speakers. Francis was talking about how migrant communities are battling and keeping traditions of solidarity and mutual support alive and trying to publicize this situation. And I wanted to ask all of you, because you're working in different contexts, what we can learn from each other about the kinds of messages and ways of publicizing the situation that are working, and where those messages are getting stuck or being violently rejected. So it was to invite you to share a little bit further what is working in that regard.
Okay. Shall we see the screen to see who want to answer first? Maybe Francis or Thuraya. I don't know if Thuraya is still with us. Petra?
Yes, it's a very nice question, because it's one of the things that came also up with the consultations, with the meetings that we had with several organizations, that for so long there are a lot of reports, and already from 2000, since the Linkage Act was installed, 10 years later, now 20 years later, there are a lot of reports, and sometimes it's a little bit repetitive, that you think, my God, we know this, we know what is going on, you know what's going on. So on the one hand, that's their part. There are a lot of reports, there are a lot of cooperation, there are information that it's there, everybody knows, but it's still, the situation is also still there. So that's the negative part. To say also something nice is, for example, the Linkage Act that was in 1998 was in the beginning only access to healthcare in life-threatening situations. So if you really nearly drop that, it was not when you break your bones. It was not for cancer treatment, because then you are going to die in a little while, or a little bit later. So it's not life-threatening. There is a lot of cooperation and a lot of campaigning, and that have led to a change in the system, that the access to healthcare is now more open, but of course not more on paper than in reality, but at least it's more there. There is a possibility to get there. So it is a little bit two ways, and I think the cooperation is really very important when we are talking about gathering data and reports, etc. So that's already very important to do, and because then you can campaign for some change. The difficult and the risk is that mostly it will only be changed. That is a little bit in the design. It is hardly ever a real systemic change that really will improve the situation. How do you call it that? And really a systemic change of the situation, of the position of migrants and refugees in general, and especially of undocumented migrants and refugees.
Thank you so much for the contributions.
May I?
Ah.
Oh, yes. Sorry, I have already.
One last remark, because we need to move on. Otherwise, we will be very much behind the schedule.
Oh, thank you so much for your testimonies. I have a question that occurred to me with a point that Frances made during her intervention, but that I would also like to hear Petra and Yasmin's opinion on it, if possible. So even though, as you mentioned, Frances, refugees in the UK were being taken to mass accommodation and hostels with bad sanitary conditions, rumors of them being hosted in luxury led to shocking videos of ultranationalist groups invading those hostels and harassing refugees. And so since the public's opinion is essential to turn this perception of migrants from threats to people whose human rights need to be defended, how do you think we can address this overwhelming, inaccurate, and very cruel perception of migrants in the UK and elsewhere in Europe? And I guess to Yasmin and Petra along the same way, along the same lines, in your list of recommendations, what would you suggest in terms of literally fighting these fake news about migrants? Thank you.
Okay, can I, in answering that, or trying to answer that, I'd also like to go back to Leah's question about what works. So there has been quite a successful, I think, sort of counter movement to welcome the refugees, to defend the people who are in the hotels. There's been a huge amount of support by organisations such as Positive Action in Housing in Glasgow, the South Yorkshire Migration and Asylum Action Group in Glasgow and in Yorkshire, Kent Refugee Help, who held the 200 people went and did a sort of ceremony of welcome at the barracks where these people were being held, and people also in Wales. There's a lot of local support. There's a lot of anti-racist work and community work being done, which is successful on a local level, but also on a more national level, because the community groups and the migrant rights groups also have been, by drawing attention to for example, the NHS charging, stuff like that. Migrants Organise is an organisation which has been going into hospitals, getting hospital staff to talk about how it feels to impose charges. And it's something they have never talked about amongst themselves. And just talking about it and expressing the unease and the conflict that they feel, it's created quite a strong movement within the NHS to abolish NHS charging. And so those kinds of movements, which work very much sort of at community level, they do work. So for example, there's huge pressure now on the government about asylum accommodation because of the work that community groups like SIMAG have done in exposing the squalid conditions and the dangers that asylum seekers face. So it's just a question of just reminding people and the government time and time again, day in, day out, that these are people who need human treatment.